Hi there, my name's Jordan. I'm a third-year medical student here at Dalehousie. My question, Alex, it kind of piggybacks on yours with regards to essentially primary prevention. I know myself, being a future prescriber of prescription medications, as it stands right now, we can pat ourselves on the back with our universal healthcare system, but without a universal Pharmacare system, at the end of the day, our current system isn't equal and equitable to a lot of our population, and I've seen it firsthand, where I've prescribed a medication to somebody, they come back and say they can't afford it, and we have to essentially give them lesser treatment for something that's more affordable. So I was wondering if you can speak on the government's plans and the federal government's plans for universal healthcare.
Yeah. As I said earlier, and you're absolutely right about this, Jordan, there is going to be, and we must be thankful for it, significant improvements into pharmacological solutions to problems that right now require either hospitalization or interventions or surgery or those sorts of things, and that is a good thing. We have continued to see massive investments in research into new drugs that is very complex, although I was just down in Toronto at one of our top quantum computing institutions, Xanadu, that is creating a computer that is able to do the kinds of calculations involved in simulating drug trials to be able to test a wide range of different formulations before they actually have to move to the various stages of clinical trials. There is technology that's going to make the drugs that we get and that you will prescribe much, much more effective. And of course, they come with significant research costs, and there is a need to be able to support that innovation in the pharmaceutical industry. At the same time, we need to make sure that we're completing the work of universal healthcare. Universal healthcare, when it was first conceived of all those decades ago, was really about doctors in hospitals, and that's it. Thank God our understanding of healthcare is much broader, much more nuanced now, and goes into prevention in all sorts of ways, goes into much better community care and home care and all those sorts of things. But a big piece of it that was left out then was proper pharmacare. We have moved forward in real ways as a government to bring down the cost of prescription drugs. We brought in bulk buying. We've created a Canada Drug Agency to create a Canada-wide list of drugs that should be covered, bringing down the cost of the most expensive drugs and the most common drugs as well. We created a high-cost rare disease drug strategies that is there to support, when a province, particularly a smaller province, has maybe 3 people who need a very specific course of very expensive drugs. We know that that's something the federal government can help with and hasn't. So there's lots of things we're doing. We even moved forward with Pharmacare project in PEI that's been very successful. But again, it's one of those things where there is a huge variance across the country. Quebec, for example, has a very strong pharma system that they are in generally very pleased with. And anytime I say, well, we're talking about national pharmacare, they're like, okay, but don't do it for us, just give us some cash. And other places like BC have great formularies. Other places are a little. So we're trying to bring the country together and make sure that provinces are also stepping up to get that right list the right way. But there's huge things we can do around bulk buying that moves us in that direction, and we're going to keep doing that work. Thank you, Jordan.